Hi, my name is Tressa. I'm going to be doing my trach video today on August 27th at 8:45 in the morning. So I'm first going to walk into the room, introduce myself, perform hand hygiene. I'm going to make sure that I verify their name and date of birth, make sure they have orders for Trach Care today. I'm going to assess their lung sounds, making sure their respiratory rate, effort, depth. If I see any drainage or anything like that, I'm going to make sure I put that down to document later. During this time, I'm going to establish a form of communication during the suctioning part. So if he needs me to stop, he's going to raise his left hand. So I'm going to explain the procedure to him. If he has any questions, I'm going to answer those. And then during this time, I would put on clean gloves. I'm going to check the suctioning, making sure that it's between 80 and 120. I'm going to take off my clean gloves, throw them away. I need a trash can. During this time, I'm also going to be hyperoxygenating him before I suction. So I'm going to turn the oxygen all the way up so he's getting hyperoxygenated. For this procedure, you can wear a mask or you cannot. It just depends on if you feel like if he coughs at any time, if you're going to have an option of getting sprayed in the face. So I'm going to put it on, but I'm just going to say I'm going to do it. And then I would put a towel across his chest. Okay, so now I'm going to start the suctioning. I'm going to open the suctioning tray. I'm going to put my sterile gloves on. Okay, so I'm going to open the saline in here. I'm going to wrap this in my hand. I'm going to take this, now that is my non-dominant hand, is going to be my unsterile hand. I'm going to remove the trach collar. I'm going to grab the suction, attach the suction. I'm going to lube the catheter with some saline. I will insert this into his trach 5 inches or until I meet resistance, and then once I meet resistance or the 5 inches, I will pull back about 2 centimeters. Once I'm pulling back, I will intermittently suction no longer than 10 to 15 seconds and rotate the catheter as I'm pulling out. Now that I've done suctioning, so you give him about 30 seconds or a minute break, and then you can do it, suction him again, or you can suction up to 5 minutes long period time. After I suction, I'm going to assess his respiratory rate, effort, making sure his lungs are clear, checking all the things I did prior to suction, see if he needs suctioned again. With this one, I determined that he doesn't need to be suctioned again, so I'm going to remove the suction catheter, and at the same time, since we're going to be doing Trach Care after, I will remove the V-sponge from under the trach. Wrap it all up in the glove and discard. I will perform hand hygiene, putting the trach collar back on while I set up for the Trach Care and turning it back down to what he was on prior to Trach Care. I'm going to clear out my area. Now I'm going to perform Trach Care. So I'm going to open this up, providing more of a sterile area for me. Put on sterile gloves. I'm going to empty all the contents onto my extra sterile field, which I have excess gauze, another V-sponge, a trach collar. I then will have a brush, some pipe cleaners, and Q-tips. I'm going to empty my saline, half of it into one department, half of it into the other. I'm going to tear my hydrogen peroxide and put it in one of the departments. Now that I'm set up, I'm going to take my non-dominant hand, which is the non-sterile hand, remove his trach collar again, remove the trach, I'm going to grab my brush, dip it into the saline hydrogen peroxide solution. I'm going to clean the brush or the inner cannula, making sure I don't touch my clean hand to the trach, cleaning it all the way around, not over my sterile field. I'm going to now drop this into just the saline solution, picking it up with my sterile hand, tapping it on the side to get the excess sterile water off, inserting the trach back into Once I hear a click, the trach is now back in. So now I'm going to clean around the trach. So I'm just going to use a Q-tip with my sterile hand still, dipping it into some sterile water. And I would just clean around the trach, getting all the excess drainage or anything he had around the trach. Discarding of that. I'm going to now change the trach tie. So this process is not sterile, so I'm gonna grab both of this with different, both of my hands. So in this situation, if you do it by yourself, you would make sure that you would secure this trach tie before you would take this other trach tie on. But for now, I'm gonna say I'm gonna have somebody in the room. So if someone's in the room, I would have them hold the trach while I untie the trach tie. I'm gonna lift his head up. Putting this back around. So I'm gonna put the trach tie back on. I'm gonna secure it, making sure it's tight enough, but not too tight, making sure I can get a finger between him and the trach collar, so it's not too tight or too loose, so he doesn't dislodge his trach. I would change gloves, clean sterile gloves, but for this video, I'm just gonna keep my sterile gloves on and pretend that these are sterile again. So I'm gonna put the new V sponge back in. I'm going to use a Q-tip. Now that the V sponge is back in, I would lay him back down into the comfortable position that he would prefer. Put his trach collar back on, making sure it's still at the level that he was prior to the suctioning and the trach collar, the trach cleaning, and then I would remove all the equipment that I have on the bed, making sure he's comfortable and doesn't need anything before leaving the room, and make sure I document all of my findings.